Great. Well, welcome everyone. Thank you for joining us today. I'm Shelley Shaw with the Office of Community Health and really excited about the speakers we have here today. So just a quick reminder that this is being recorded and in consultation with our guest speakers here, they've offered to please share your questions in the chat as we go, and we'll see if we can facilitate some dialogue throughout the presentation as well. So I am really excited to introduce to you today Dr. Alyssa Ramirez and Evelyn Cruz. Dr. Setege is a queer, bilingual, US-born and Mexican-raised Latina counseling psychologist. Her work is focused on understanding and developing culturally grounded, Latinx-centered psychotherapeutic practices through a decolonization framework that integrates Indigenous knowledge and community-based approaches. Alyssa currently holds an appointment as a clinical assistant professor in counseling psychology at UW-Madison to develop a bilingual Spanish and English psychological services certificate centered on liberation psychology and radical healing in partnership with Centro Hispano of Dane County through the Esperanza Project. Evelyn Cruz is the Director for Program Planning and Evaluation at Centro Hispano. Evelyn provides community leadership for Esperanza, a mental health equity partnership with UW School of Education psychology programs. Evelyn has over 20 years of program development and implementation focused on improving the working conditions and the health of racial and ethnic populations here in Wisconsin. Evelyn loves gardening and practices meditation and Qigong. I also thought I would take a personal liberty with Evelyn's bio and add teacher to that as well, as I have been very fortunate through the years to have the opportunity to learn a great deal from Evelyn. As I work on improving my own self and the ways I show up, Evelyn has been an important teacher to me, always helping me center on relationships, well-being, and healing. So I have had the great opportunity to connect with Dr. Setege and Evelyn and share our department's interests in creating pathways to family medicine for people underrepresented in medicine, our interests in creating a culture of belonging here at the department, as well as addressing burnout that affects so many here today. So I hope you'll see many points of alignment and ways we can continue to learn. So with that, I will hand it over to Dr. Setege and Evelyn.
Thank you. I guess I'll start with Esperanza, Nuestra cultura de salud. It means hope, our culture of health. And as Shelley mentioned, it is a mental health equity strategy that it is being implemented in partnership with the School of Education to increase mental health and well-being in the Latinx community. Alyssa, anything you want to say here? Right. So I just will very briefly talk about Centro Hispano. Many of you might already know Centro. Centro came to be for the need that immigrants, especially the Cuban immigrants in the 80s, and it's evolved to support the broader Latinx community in Dane County. The mission of Centro is empowering youth, strengthening families, and engaging the community in such a way that Dane County will be a community where Latino families can aspire upward to reach their personal goals, dreams, because they feel engaged and strengthened with the tools of success. And for Centro, our values are very important and ground the work that we do, and you'll see that a little bit more. And this is a picture of Centro Hispano's Sun Prairie office, where we have good relationship with the police department there. And this was a driving presentation, because this is a huge, important issue for the community. Next slide. So how do we organize the work at Centro? So I mentioned the 3 pillars around youth, families, and community. So we actually work to, we use a public health framework, and many of you will be familiar, I think all of you will be familiar with with this framework from Healthy People 2020, People, Healthy Wisconsin 2020, and the Robert Wood Johnson Foundation, the county health rankings framework. That is the one that we use in here. So most of the work that Centro does is in the social determinants of health area. Most of you work probably in the health behaviors, access to care. So we'll talk a little bit more about how the public health framework that Centro has supports the way that we implement and design and implement programming. Next. These are the three four youth programs. In the Empowering Youth Priority, we have a memorandum of agreement or a memorandum of understanding with the Madison Metropolitan School District, and we implement Juventud a la Escalera in the sites. So we have 8 sites that we do, 7 sites, I can't count, that we do programming. And the focus of those is around shaping the life and vision for Latinx, young Latinx, and to provide engagement opportunities and cultural grounding. We have 2 other programs, Regeneración, and that's a peer-led program that is across Dane County. And the way that we work with Regeneración is to provide support for cultural identity, social justice, engagement, and organizing. And then we have a newer program that's about a year old, and that is Avanzando. It's a college transition program, and it supports a lot of the youth in moving into higher education, which oftentimes is a first generation thing for many of our Latinx communities. But around all of this, we work to promote social and emotional development, to support perseverance and grit, and to have a learning and social skills mindset for supporting the youth. Next. The second pillar of our mission is strengthening families, and we have a series of programs that provide case management and referrals, navigating systems, provides data to our funders, the city, the county, and others around gaps and needs for the community. We provide cultural and linguistic appropriate services. So we would serve Latinx that speak English or Latinx that for whom Spanish is a more appropriate language. We do that. All of our programming is grounded in culture. So we do that from that cultural perspective too. And some of the ways that we support, navigate, as well as provide training here is around employment. We provide immigration support, and we have clinics that we have through partnerships, and they work on legal issues. So we have a set of scope of programs within Centro, and when we are not able to provide the service, we do referrals. We also do a lot of outreach through partnerships and through some of our community partners, like the Promotoras de Salud or the radio station, etc. Next slide. And then strengthening families is the third pillar. And in here, oh, I'm sorry, these are the programs that are part of the strengthening families. So family support, new routes, which is a jail diversion program, immigration services. We have a healthcare navigator, a bilingual navigator, and we have workforce programs for work readiness that on our Caminos. EW Hospital is actually one of our big partners for Caminos CNA. Next slide. This is the third pillar. Now I'm here. So the third pillar is engaging community and fostering a safe space. We have Zumba classes, we do gardening, Mercadito. So there's a series of programs. We do Tres Reyes, Three Kings, Dia de los Muertos. So we have signature events that are also more culturally supportive, and other programs that are more about sort of the day-to-day needs around physical activity, food justice, etc. So these are the 3 main focus of Centro. We do, as public health programs do, We have a multidimensional approach to the work that we do. Our youth aspirations are center, then outwardly adult center programs to support youth, community engagement, to create safe spaces, and then system level works through partnerships and other means. Next slide. The motivators, and I think Alyssa, you can jump in here because I think this is a good one for you.
Thank you, Evelyn. And thank you, Shelley, for those wonderful introductions as well. I was having trouble with my mute button, so I'm just going to leave it unmuted to have this run more smoothly. But so where the School of Education partnership came in was actually through a Wisconsin partnership program. So we have a very big grant that was funded, and part of the motivators for getting that grant were a lot of the things that we were seeing even pre-COVID, so pre-pandemic times, about the injustices that our Latinx or Latina communities were experiencing locally. So having communities under siege, family separations, children being put in cages, vigilantism, public policy of cruelty, racial profiling, and obviously the direct and vicarious trauma that our Latinx communities experience because they're witnessing all of these things happening over and over again. At the same time that they're experiencing a disproportionate amount of trauma, there's also an incredible workforce shortage particularly for multilingual and Spanish-speaking Latinx folks. So if we look nationally, there's about one bilingual Spanish English speaking psychologist for every 4,500, right? So we have very, very few people and only 4,500 folks nationally who are in the US providing these services. If we look at that in our workforce locally in the community, we also continue to have disproportionately low people coming into the workforce who are able to provide Spanish-speaking services. But not only that, also thinking about all the cultural pieces that are really important in working with our Latina communities. So often because of this shortage, the language of provision of psychotherapy to address the experiences of trauma are often determined by the provider's language of choice because there's no other alternative, or often we're using interpreter services if even that is used. We also see a lot of pushback in providers using interpretation services. Often we know the role of language is very important in psychotherapy. And so Latinx clients not only are receiving often services in English or through interpretation, but those may also be the language in which they have themselves experienced oppression, right? Or are being oppressed by folks in the community. Mental health treatment is verbal, right? And so we also find that there's a lost opportunity. So folks like myself, so I'm a graduate of the counseling psychology program here at UW-Madison. They're recruiting folks like me who are bilingual, but we only get trained in English too. So there's a huge lost opportunity in that as well, and a pressure to assimilate to predominantly white spaces in a predominantly white institution that don't necessarily prepare us to do the type of work that we need to be doing with our Latinx communities and in Spanish. So Esperanza was born. There are a lot of folks who are affiliated to this Esperanza project. We are at the helm, we have Evelyn Cruz, who's our project director of Esperanza in the community strategy side at Centro Esperanza. She's also, as we said before, the director of program and planning and evaluation. Dr. Steve Quintana is the UW-Madison grant lead and the principal investigator. I'll talk a little bit more about all the types of work that we do as part of Esperanza. Dr. Karen Menendez-Coller is the executive director of Centro Hispano. And then myself, I will be the director of the bilingual training certificate that is aiming to recruit and train bilingual students in counseling, school, and rehabilitation psychology. We couldn't do all of this work without the fabulous students who are affiliated to our program, and we're hoping to continue to increase that. So we have Gabriela Gauss Hinojosa, who is second-year PhD program student, Natalie Ramirez, also in the counseling psychology department. She is actually starting in the doctoral program, so we've been very lucky in recruiting and retaining students already. Hopefully we'll recruit and retain Daniela Robledo, who's currently a master's student, and I'm hoping that she'll stay for the doctoral program. And then Danya Soto, who's also at the School of Psychology program. So what we're hoping with Esperanza is really to improve social and family well-being. So we want to strengthen the resilience of our immigrant families in the context of acculturation pressures, the impact that they have of experiencing racism, terrorism, and continuous dehumanization. We also want to improve psychological health, and we hope to do that through developing and providing these linguistically, culturally, and situationally appropriate mental health services. So overall, we are really grounded in the core values of Centro Hispano as well, and really thinking about how can we develop a Latinx community that is characterized by health, by well-being, that really harnesses the continued agency that our community shows, visibility, empowerment, respect, pride, and dignity. So there's a lot of things that we do, as I said before, and I'll talk about each of these. So I'll talk first about on the UW side, and then we'll go into more specifics about what all this looks like. At UW-Madison, Esperanza, we have kind of the traditional research stuff that we're doing, and that's where Dr. Quintana comes in. He is supervising the students who are doing some research projects already about understanding the experiences and training needs of multilingual psychotherapies in these types of what we call new growth Latinx communities like Madison, where we see a large influx of mostly first-generation immigrant folks who are mostly Spanish-speaking. And thinking about what is the role of language. So translanguaging has been what Natalie Rivera is working on, a model of language usage in psychotherapy. Then at the UW side will be the stuff that I'm also helping develop is the actual bilingual certificate. So we will have 5 certificate courses over about 2 years, total 9 credits. But we're also thinking a little bit more about what are the other things that students need to be connected to also thrive in this predominantly white institution. So being able to engage things in like mentoring, and I'll talk more about what the SEMRAP program involves. On the Centro side, we have a lot of planning and development, and Evelyn will talk more in depth about all these pieces that we do, but it really includes keeping track of our outcomes. What are we doing in terms of staff wellness, staff training, leadership development, both with Centro staff and in the community, and how that trickles to the folks that we're serving, right? So youth, families, etc. We also are doing all that program evaluation to see whether or not, what are the outcomes for the stuff that we're doing. And then kind of in the middle, the community engaged work that we do, where we kind of, in all of this, it's truly a partnership and where we're bi-directionally and multi-directionally working on this together. And then in the community engaged part, both Evelyn and I co-lead a healing ethno-racial trauma community of practice that we'll talk about in a bit. We're both part of the Latinx Mental Health Coalition. And then we also help with some program development with other community partners as well to continue increasing the workforce and addressing, again, that disproportionate trauma that our Latinx community experiences. So our hope that all of these pieces kind of trickle in different ways to have an impact on our Latinx and university communities. So we're really, again, like Evelyn was talking about, we're kind of incorporating a lot of different public health and psychology frameworks around thinking about more broadly, what does it take to actually have a healthy outcome, right? And here we're really inspired by Dr. Adames and Dr. Chavez Dueñas. They have a no health without mental health and no health without systemic change framework. And our hope is that by doing some of these pieces, particularly, we're particularly targeting both coping behaviors and family support that are kind of the traditional psychologically based interventions that we might target, but also institutional interventions through personnel and leadership development at Centro, in the community, but also in the clinical training that we're doing at UW-Madison increasing that bilingual workforce out into the local community, and then doing kind of a cyclical program evaluation and advocacy at different levels. So the hope really is that this will overall address some of the structural factors, some of the social determinants of health. And I think we could even start be thinking about how do we build some of these community partnerships that address other pieces like physical environment, etc. So very multifaceted, multidimensional, and multidisciplinary approach. So Esperanza at UW specifically, we're housed in the School of Education. As we said before, I'm a faculty in the clinical psychology program. And really, we're focused on creating a pipeline of mental health providers. So our hope is to recruit and train heritage and other Spanish-speaking students to provide linguistically, culturally, and situationally appropriate services in Madison and Dane County. So we would have students at different practicum sites across Madison practicing these bilingual skills, working with our local Latina population, and then approach this provision of services through an interdisciplinary anti-racist and decolonization frameworks, and have students develop research and innovation that, again, serves back our community. So our target population for the certificate are graduates, so master's and doctoral students who are currently in any of the School of Education psychology programs. So that includes counseling, rehabilitation, and school psychology. As we build this, we are hoping to expand it to other folks like social work, or even potentially think about medical residents, other folks who might be in a helping profession that could also benefit from having basic psychotherapy skills in Spanish and the theoretical framework to work with our Latina population. So once we are officially approved, we're still in the process and going through it. We're hoping for an official approval to start by spring of 2023. We'll have students submit a letter of submission. We need them to have intermediate to advanced Spanish, so there will be a language component that they have to provide kind of evidence that they have that language capacity, and then their own program approval. So having their own, whatever program they're coming for, having that support. We are already starting, so our courses are already completely approved. So we are already starting to teach those courses this academic year. So the first one will be taught in spring of 2022. And then again, hopefully we will have an official recruitment of an official cohort that would be doing their admissions process by fall of 2022, and then starting their actual courses by spring of 2023. But our hope is to really nurture mental health providers that promote transformative and radical healing. And what we mean by that are multiple things. We want students and mental health providers who are critically conscious of all the different levels of need in our community, but also are part of an active resistance against these oppressive forces. That there is accountability, so we're switching kind of our mindset with our communities from a power over to how do we have a power with stance with the communities that we're working with. That support and promote the empowerment and radical hope for other folks. So we don't want folks who are constantly like stuck in the trauma struggle, but how do we re-envision a lot of possibilities and harness a lot of the strengths that our community already has. As I talked about before, it's multi-systemic, so we do an effort of having community partners across different programs and supports. We want to redress systems of domination, so how can we create cultural equity? How can we increase cultural authenticity and self-knowledge? Often our students are Latinx themselves, so it is a homecoming experience of sorts, and we want that to be so that they are also nurtured culturally. And how can we promote cultural humility? So having a person-centered, self-reflective, and continuous learning mindset when they're going into this type of work. But to do that, you know, we're asking a lot of our students, so we also want to give a lot to them. So we want to provide opportunities that they can also engage in culturally and linguistically affirming programming. So things like community building events, having a welcome potluck, having an actual writing retreat where they can really focus on harnessing their writing skills, both in English and Spanish for different academic publications, or even advocacy efforts or public facing kind of efforts as well. Having monthly charlas where we bring in different community partners to talk about their work, building a Latinx alumni connections, and then doing some supervised advocacy skills development. And we also have a PASOS mentoring program where we're, again, creating a pipeline. How can we get undergraduates at UW-Madison through graduate school as well? So thinking even ahead, previous generations, how do we get them into these types of programs as well? It's a 2-year cycle. I talked about the certificate admissions will be in the fall. There will be 5 courses. The first 2, the Radical Healing and Ethics of Latinx Bilingual Training and Dimensions of Latinx Mental Health, are foundational and theories courses. These are really where they get all the theory and philosophical foundations for the work that they'll be doing. And then they'll have a Strengthening Latinx lab where they actually practice their skills in Spanish to provide psychotherapy. And then a year-long accompaniment of supervision in Spanish at the university will be the Prac 1 and Prac 2 while they're doing their practicum experiences. We're asking for about 25% in Spanish in different community practicum sites. Okay. Evelyn, take it away.
Evelyn, before you hop into that, we did get a question in the chat. Just wondering about, as we center on Latinx populations, wondering what you recommend for folks who are not non-Latino, Latinx. What resources are there for non-Latinx adults working with Latinx youth and families, or perhaps misconceptions or important things to know?
I think that's a big question. Yeah. I think with any work, so one of the classes that I teach in undergraduate at UW-Madison is about working with diverse communities. And often what I teach students, that really it's about thinking about your relationship to whatever community that you're relating to, right? And it could be communities that even you're a part of, but that piece of self-reflection is probably like a really great first step. I think often we're kind of taught to think about other populations in stereotypical ways. And every Latina person is going to have their own experience of whatever it means to be Latina. So really a great place to start is by asking folks their experience, their understanding. And then thinking about how do I build then that connection? If you're working with Latinx youth and families only in the context of your work, thinking about how can I build that with other people outside of my day-to-day life, right? It could be through media consumption, right? Like, do I consume media that my Latinx family people consume, right? That gives me an insight into what people are looking at. But then also, how do I develop those relationships in my community, right? Where do I go grocery shopping? What events do I attend? Like, I think there's a lot more that we can be doing to really create authentic relationships within that community.
Thank you, Alyssa. I don't have a whole lot more to add, just to emphasize that for me, it's about relationship building. And if you're working with or want to work with, really getting to know people before you decide to plunge into working with them, and really trying to make that your work, not their work, to help you understand what you need to know, but for you to take that leadership to know what it is that is important for the relationship. Next slide. So Esperanza at Centro has a number of strategies. I think of Esperanza as a continuum where the university does a lot of the structural and workforce related pieces of the clinical part and the learning piece. So building that workforce, that structural piece of workforce. And then at the other side of it, at the community side, is more upstream, and it is about prevention. And so the transformative evaluation is one of the strategies at Centro, and it is really around harnessing the voice of the agency and the community. We do evaluation of everything that we do. All of our funded programs have evaluation. And a lot of that is what our partners want to know about how we use their funds, how many people we see. The transformative evaluation really for us at Centro is a way of reflecting on the work that we do and how we do the work, what partners, what kind of change do we have for the staff, for the agency, for the community, and for systems. So that is sort of the gist of the transformative evaluation. And we just started planning, and we're in the data collection and starting to work on that. Thank you. So youth evaluation is another one of the strategies. We are working, and the light keeps going off. So if I look like I'm in the dark, I'm really not in the dark. It's just dark here, but I'm not in the dark. So youth evaluation is one of the strategies. For everything that we do, we really have a lot of partners. For the transformative evaluation, we worked with Dr. Becken, who retired last year. And the last project that she did with the students was the transformative evaluation plan for Centro. And then for the youth evaluation, we are very fortunate to work with the Wisconsin Center for Educational Research and Alyssa, and the amazing work that she does. And so we are working, they provide the expertise to support youth in building collective capacity for youth voice. And you might see a theme around voice, leadership, because these are the upstream measures, the upstream strategies that we're using in order to promote wellness and well-being. And then for youth to define measures to really harness their voice into building structures and spaces that they want to be in. As well as to support systemic change for equity. So a lot of it is around critical thinking and voice to support youth in their voice being out there into the systems. Next slide. Staff wellness is a huge piece. This actually started prior to Esperanza, and seeing if I can get some light in here, but it didn't work. Okay, so the staff wellness actually, I came from working at the state health department for many years, and working at the state health department, I could see how often the people of color that are out there doing the strategies and receiving all the emotional burden of systemic oppression really need that space to be well, so that they can be at their best to be bridge, to be to try to speak truth to power. And when I came to Centro, this was really dear to my heart. The ability for us to work on health equity, but a little bit differently, really from the inside out. So for me, it was really important that staff were well, emotionally, mentally, spiritual, in order for us to provide the best service. It became a strategy in our strategic plan. And so the fact that that it became this piece that is now what we do, it really has become an operational necessity for us, especially during COVID. We did a lot of work to support staff and understand the needs as they are receiving the burden of what the community receives. It comes through them into the agency for support, while they themselves are experiencing many of the same barriers and needs that community members come to receive services for. So maybe next slide. So we ground the work for the wellness plan at Centro on our values and fostering connection, respect, nourishing community, living with courage, and demonstrating integrity. All of these things for us start with me, and then out to my peers, and then for the whole agency, and then outward to the community in the way that we provide services and in the way that we relate to partners. one of the things that it was also really important for us at Centro is to create the kind of environment that we want to work in. And for that, we had the support of some amazing people at the School of Medicine and Public Health that helped us put together a declaration of interdependence. So we worked with a match group to support us in putting together, bringing us together to understand how do we want to be with each other. The fact that we are a social justice agency that provides services and support for human service needs in the community also means that we live the structures of oppression. And so how do we leave those behind in as much as we can, and that we have an intention of really being in a space where we want to be patient with each other, that we give each other the space that we need when issues come up, misunderstandings come up, to listen to each other, to offer kindness and compassion through hugs and food and listening and flexibility. So these are the ways that we have decided that we want to be with each other. Constructive feedback and reflection. I think I especially I get angry, right? But I don't want to speak from a space of anger, right? And I really have a difficult time when people do that for me, and then I need that space. And so it's really important for me to understand that that interdependence, right? And so these pieces are in our handbook. Our employee handbook has not just the anti-discrimination pieces that we must have as law-abiding agencies, right, or structures, but we also have the how do we implement those? What does that mean in the day-to-day? Next slide. So we ground our wellness for staff in the wellness that we wish for the community through our services in a multi-dimensional way. So we think about wellness and the 8 dimensions of wellness. You might be quite familiar with this as the SAMHSA framework. And we have intellectual, emotional, physical, social, occupational, financial, environmental, and spiritual. And so this for us, as I mentioned earlier, is an operational necessity. We are the community that we serve, and we experience barriers in the same way that everyone that comes through our doors. And so we have a planned approach to address all of these things. I will not share all of them with you, but I will share, next slide. I will share a little bit about how we think about emotional, mental, and spiritual health, which is the one that we have focused on during COVID times. And we have 3 tracks at Centro for that. One is the Esperanza Wellness track that I will share a little bit more. We also have a track around leadership and around technical skills. So we have 3 tracks for ser, to be, hacer, what we do, and crecer, for our growth. So these are the 3 pieces that are part of our wellness plan. I will tell you around the Esperanza track. Ooh, back. Thank you. I will tell you about the Esperanza track, which is the one that Alyssa and the students have really provided us with such support during a time that has been very, very difficult for everyone, including the staff at Centro. So under the Esperanza Wellness track, we have had conversations around structural oppression, understanding what it is, understanding how we live in it, how we embody it, and what are the intentions that we need to have in order to move beyond that. We have one-on-one conversations with staff, with our managers, and that is also structured around well-being and ensuring that people have what they need, and managers are the first place where people come when they have when they need flexibility at work, when they need time off, and we encourage time off. And then trainings around reflective supervision, all of the things that the expertise that our partners in this UW side of Esperanza have been able to provide. As well, the healing ethno-racial trauma community of practice that Alyssa has spoken about is a really important piece. And then trainings and supports that Alyssa has provided and are sort of in the planning also for our youth who are supporting youth that are very impacted by many of these issues. Next. And I will let Alyssa talk about the no health without mental health in the community. Oh, I will say first that at Centro, this is what the multi-level approach looks for each of these pieces. For the systems change, I am a co-lead for the statewide Centro in Voices group. We publish guidelines for engaged research, and those are at ICTR, a couple of places that are linked there. Is about, I think the person that had the question about how to work with communities, this might be an interesting tool that they might be able to look at. It is also what grounds the memorandum of agreement that we have in the Esperanza, UW and in Centro, is also grounded on these guidelines for sort of engaged work. And then cultural adaptation, which is in the very, very infant conversations with the state health department. I'm sorry, with the state, at the state mental health. And then the community engaged work, the community of practice, the hard community of practice, leadership development, that Roots for Change provided in the past, and then the collaborative for the Latinx Mental Health Collaborative. There are other collaboratives that we're a part of that are not here, but these are the ones that most focus on community engaged work around mental health and well-being. And then transformational evaluation, youth voice, and then staff wellness. So I think after this is yours. Oh no, this is the tool that I mentioned. There is a link to the tool that is linked in a couple different places, and it has modules that UW Prevention Research Center is putting together for the training that they're doing with the Community Advisory Board. They're also linked at Centro Esperanza page, but they're also linked with ICTR. Next.
And the Healing Ethno and Racial Trauma Community of Practice is something that Evelyn and I started at the beginning of this year. Again, really inspired by Dr. Adames and Chavez Dueñas' work. And specifically, they have a heart model that they came out with about what would it mean to heal ethno and racial trauma, particularly in Latina communities. So really our focus for this community of practice is to bring together Latinx and Latinx serving mental health providers across different systems, both at UW-Madison, but also across Madison and Dane County, to figure out what would it mean for us to promote that healing ethno-racial trauma in our community locally. So a lot of it is how can we promote practices and collaboration and critical transformation of the systems that we work in so that it aligns and enhances our collective impact. How do we address these social determinants of health, and how do we change some oppressive conditions? Honestly, it's been like a kind of like a respite space in some ways to be able to talk about all the different challenges that we see at the different intersections of the work that we're doing across different community members. It's also a space that is Spanish speaking. So that's quite unique in that we don't really have a lot of spaces as mental health care providers and supports that we come together and consult and talk about these things in Spanish. So our hope is that it will also provide some meaningful grounding for our bilingual trainees in what our community looks like, what are the experiences happening, and create a space of learning and interaction among different people that we can also share resources and build community with each other.
This is the training that we have been doing around community leadership development. And this is the training that Raíces de Liderazgo and Raíces for Roots for Change, Raíces de Cambio. They have been facilitating these trainings. Last year, they facilitated also some trainings this year. They are part of Esperanza, and they're part of the community leadership training that we are doing, as I mentioned, to really support voice at all different levels in a multi-level approach throughout the agency, the community, and outside. Next. We have started conversations with the folks at the state level that work with the peer support program. The certified peer specialist would provide some of that workforce training, that structural piece that is a little more at the community level. There's a very huge interest from their part. At this point, their peer specialist team has had some vacancies at all levels. The outside partner that works in implementing the certified peer specialist, as well as inside the people that manage inside the building. So we haven't moved very forward with as well as we would have wanted to, but these are some of the concepts, some of the things that might already be in the peer specialist, but that we, through our collaboration with them, want to see that are a little bit more strengthened, not just for the Latinx community, but this would be a systems change that would impact all BIPOC and the majority community, because it would be part of a statewide training. So historic and social political context, the effects of racism, trauma and healing, liberation psychology, intersectionality, collectivism, critical consciousness, self-knowledge, hope, strength, and resistance. And I will also say that some of these pieces, we really want to see them not just here with the certified peer specialist, but we're looking for other opportunities that could provide systemic change, where we can start to speak about the health and well-being of communities in a way that actually centers wellness, that we actually think and look at what are the things that we need to build on rather than the things that we need to fix, because those are pieces that would flip a little bit the way that we think about health, would flip a lot how we think then about what are the things that we need to do if we start to think with a mindset of what should we build on rather than what we need to fix. So if you see some of these concepts in here, they're a little bit more in the positive and a little bit more in what are the things that we want more of. And that's also a really important part of the way that we are working in Esperanza. We really are trying to flip a lot of frameworks from partnerships, from the way that we measure health and wellness. And so stay tuned for some of that coming up. All right, next. This is the place where Esperanza is linked at Centro if you would like more information. It isn't as built up with things as I would like to, but hopefully before the end of the year, there'll be more, and there will hopefully be, once we have the certificate or maybe sooner, I don't know. I'll let Alyssa speak about that. But thank you so much for your time. Alyssa, go ahead.
Yeah, let us know if you have any questions. That's all we have for now. Yeah.
Thanks so much, all, and just continue to be inspired every time I hear from you. I think every time I hear about your declaration of interdependence, it's something I would love to be a part of. I think I'm inspired by the way you are redefining what a pathway program could look like for your learners. It's not focused on making them fit into a system, but changing a system. And really struck by the depth of support that and community that you're creating for your team, and centering on such an asset-based approach. So much for us to learn from the work you all are doing. And I think my colleague Maddie Botsley landed kind of a big question in the chat for you, and maybe something for all of us to consider together. But how can the department staff, faculty, and programs help support your work and partner with you all if appropriate? And I think too, I want to just welcome folks to turn on their video if they feel comfortable. Sometimes that helps create a little more space for conversation.
So I will mention that we've had a number of presentations from Dr. Kiefer at Centro to support our staff wellness with important information that is that supports our staff. So it really depends what you have, what you want to offer. We are not always, and I think that this is an important piece too, we're not always able to partner when our capacity is not there to do what you might want us to do. But as you are working on things, as you are thinking these might be resources that could help, please feel free to connect with us. And if we're not able to accept your support at this time, it is not out of anything other than sometimes capacity, and there might not be a Venn diagram that connects us at that point, but that doesn't mean that it couldn't in the future.
You know, I always this is so inspiring. Um, you know, I'm always interested in origin stories. And how did you get to where you are now? I'm just curious, how did it start? Was it with a learner? I don't know if you can encapsulate that. I'm sure there's much to say there, but would help us think about going back to Maddie's question, like, you know, a good starting place to learn from what you have learned. So thank you.
I, you know, I think for the idea, the need was there. We do evaluation data collection on a regular basis for our programs, and this was a need that we were seeing from the ICE raids, from the really violent rhetoric at the national level. There are just many ways that there's violence, and Karen and I, the executive director here, Karen and I always had that, you know, we were wishing for something like this. I really believe in divine intervention in however way you define it, but I do believe that once you know what it is that the what, even if you don't know how it will manifest, we really wanted this. And in walked in one day Steve and said, would you like to partner? And we were, heck yes, we would like to partner. And then the idea grew, the grant was written, it was put in place, and a blessing that Alyssa came into we didn't even have a name before Alyssa came, right? And so I can, for me, it felt like, oh my God, my other half arrived, because it was a way that we really are very synergistic and complementary in our thinking and our approaches. So this is what I'll say about that origin story, but I'll let Alyssa speak more about that.
Oh, I completely agree, Evelyn. And I think a lot of that we talk about, I call it the life force, right? That we sometimes speak things out and hope that the life force responds. And I often tell my students too, and I think for myself, that our frameworks matter, right? And I think I come from like an academic lineage and personal nourishment, having mentorship from folks like Evelyn and Dr. Quintana and Karen, in thinking about like how do we push the status quo and truly transform things. And when we come from it with that mindset that we're trying to push these systems, then we find ourselves making that space in any way we can. And when we don't figure it out in the system that we are in, I think there has to be some flexibility for leaving that, right? So like part of why and how I came into this position is that my position at the time, I wasn't going to be able to push the system in the ways that I wanted to. So I started looking out, and then here's the life force saying, hey, do you want to start a bilingual certificate, which was literally a dream come true. So I was like, yes, heck yes, here we go.
Thanks, Jennifer. That was a great question.
I think I might add something too, is like there is this piece of learning as we go, and like as I'm talking about making space is also challenging what things have to look like, and getting rid of some of the perfectionism that we're often ingrained in through our academic training. And that we actually do have a lot of skills, but we don't necessarily always feel like, okay, I'm 100%, 150% often, right? Ready to engage or do something. And sometimes it's just about doing it and hoping that it succeeds, and being open to feedback and failure so that we're able to continuously reflect on our process and improve it over time.
Absolutely.
But we got to do something. I mean, that's the key piece, right? Is action. We can talk about theories of social justice forever, but the actual critical point is putting the rubber to the road. Is that what they say?
Something like that.
Something like that.
Yeah.
Well, I think if we don't have any other questions, I want to just thank you for your time. I think you've definitely inspired us to take a step forward, reimagine the systems we're in, and co-create different possibilities in the future. So thank you, and we will continue to think about ways that we can be learning from you all in this work, and would love an update as you move forward and bring your new cohort on in 2023. So thanks again for your time and sharing all of your wisdom with us.
Thank you for the opportunity.
Thank you so much, yes, for the invitation.